Okay, good afternoon, everyone. This is an emergency prep support call for hospices and home health agencies throughout Mississippi and Louisiana. And today we are going to be focused on Mississippi's Harrison County. Um, to try and make sure that everyone in home care and at the emergency management levels on the same page when it comes to this hurricane season. I want to remind everyone that we are recording today's session and it will be available for home health and hospices to use along the Mississippi Gulf Coast to review with their staff so that their staff are also aware of what is going on. And if you see the schedule here as they are hyperlinked, they are available. So we'll be sending that information out to everyone as well. When we're talking about Harrison County, I just want to give some perspective here. Yeah, we have a 500,000 people who live in the Mississippi on the Mississippi Gulf Coast in District 9. And Harrison County is the largest county with a population of over 200,000 of that 500,000 number. We have about 1,200 hospice beneficiaries each year enrolled into hospice with about 865 deaths. So when we're looking at the 6 month period during hurricane season, about 430 of those deaths are going to take place during that 6 month period of time. About on the Gulf Coast, 25% of our patients are deceased within 7 days, and half of those patients are deceased within 30 days. So um, it's essential that during hurricane season, all of our hospices and our home health agencies make sure that the Harrison County officials are aware of those patients that you're identifying as being at risk, meaning that they're living alone without a caregiver, or the caregiver they have is either mentally or physically incapable of carrying through on an evacuation order, or they don't have the financial means to evacuate, or as in the case of a lot of folks that live down in this area, they're just plain stubborn. They're refusing to evacuate. Mr. Matt Stratton is our county official in Harrison County. Thank you, Mr. Stratton, for being on today's call. Is Anna Claire still helping you all in District 9? I had her listed for Harrison County. Is that still the case?
Yeah, I think she is still filling in. She's assigned to another area, but until the health department brings somebody new on for our district, she's helping out. Correct.
Thank you. Okay, I just wanted to make sure I had the right officials. And when I went into the registry this morning, I saw that you all have the bulk of the at-risk patients in District 10. You had 39 out of 69 of those patients listed. I sent you a spreadsheet just a little bit ago. Hopefully that will give you the locations. It's a little bit more detailed or sorted in a way that might be helpful to you all see where those patients are located in Harrison County. And then I have these links for our hospices and home health agencies to consult with in terms of registration applications for Harrison County, making sure that those patients are on on your radar throughout the hurricane season. Correct? These There's still a registration application and a evacuation request for those home confinement patients, correct?
That's right. There are those resources, and we also have a email inbox that is monitored by our ESF8 desk. If you have any questions, need to share information or to otherwise coordinate, you can email us at medical@co.harrison.ms.us.
Thank you for that update, and I will include that email before I send out these slides or make them available to our members and non-members as well. I did notice, I did want to point out to the agencies along the Gulf Coast that are using the at-risk registry. This morning, I found two patients in District 9 who did not have the county assignment of Harrison. And that's really important that you go back in and make sure all your patients are correctly assigned to the correct county in which they live. There's one patient in Harrison that I noted didn't have the patient's zip code listed. And there was also a number of patients that did not have the birth field completed. Again, the birth field, to complete that, it's the year followed by the month, followed by the day. I know that can be kind of confusing, but that's the way it was set up, and we haven't been able to change that since they set up the registry. We do send out these reports. I want to remind our provider community, these reports are sent out every Friday morning to counties across Mississippi and parishes in Louisiana. And that's why we rely upon your agency to go in there and do that weekly update that's so vital to make sure that we're sending the correct information to all of these emergency managers across Mississippi and Louisiana. And we do send out a reminder to everyone using the registry. If you're not receiving that reminder, the weekly reminder, please let me know, and I'll be more than happy to include you in that weekly reminder. And these are some of the websites and resources available to providers in Mississippi and in Louisiana. And the last thing I want to say is that we're going to be back on next week and we'll be looking at Louisiana region number 2. But in the meantime, before then, I want to talk with Mr. Stratton and anyone else in Harrison County to talk about especially preparations for this year's hurricane season. I know that we've had a lot of cutbacks in terms of funding, especially in terms of ESF 8 services. And I'm just wondering, are you anticipating any particular problems or do you foresee any particular challenges with regards to patients that are living in their homes and being serviced by either hospice or home health?
Well, I don't know if I'd call it a challenge, but certainly a fact is that we do have a new ESF8 coordinator for Harrison County, and Mr. Charles Wise is our lead on that. He's taken over from Mr. Greg Doyle, who served our community for many years, and as such, Mr. Charles Wise is getting to know everybody and making sure that he's got good communications with them. So at that same email address that I mentioned earlier, medical@co.harrison.ms.us, you can reach out to Charles Wise and facilitate those communications. We're actively monitoring the registry that you all are sending and making sure that we are encouraging everyone to prepare as we are expecting another active hurricane season for this year.
Speaking of, in terms of agencies having their emergency plan, do they send that to you, or would they send that to Mr. Wise?
Yeah, so Mr. Wise is going to be the main point of contact, and then he'll coordinate with us as necessary.
Well, if agencies are actually located in Harrison County, they have to send it to Mr. Wise. We suggest that you send it not only to Mr. Wise, but to all of the counties that you're servicing, so that we're all on the same page with regards to your patient's care. In terms of the specifics for patients that have been identified as needing assistance. those patients, is it reasonable to assume that they would be transported to the medical need shelter in Stone County, or is there another plan in Harrison in terms of where those patients, when there's a mandatory evacuation for their neighborhood, where would they be taken?
Yes, absolutely. The first point of contact is going to be the ESF8 desk to facilitate transportation as necessary. We do not have a medical needs shelter in Harrison County, and so there is the state medical needs shelter, which people who meet the requirements to access that shelter. But again, the ESF8 desk is going to be the point of contact for assessing and to arrange the necessary transportation.
You said the requirements, can you talk a little bit about what is required, or how do we triage ahead of time to know whether or not a patient's going to qualify for medical need shelters?
Yeah, so I think you had a couple of those links earlier. There's a couple of documents that kind of walk you through, for this type of patient, this location would be appropriate. For this type of patient, this location will be appropriate. And so if somebody is in an evacuation zone, this is the time now to plan and put the thought into that for the different people. But there's no one size fits all approach. It's going to be a case by case evaluation of the patients.
And in terms of evacuate, how do you determine when a mandatory evacuation is going to be called in Harrison County? What is the criteria for that?
So the driving force for our evacuation zones is going to be the forecasted storm surge. And so, uh, a lot of people think, oh, it's a category this or a category that, and that is not the determining factor for evacuation. It is the storm surge forecast. And given the technology limitations, we can only get an accurate storm surge forecast around 2 days prior, 48 hours prior to the arrival of the storm. And so it's a pretty short fuse. And if people are going to need longer than 2 days' time to make their arrangements and to make transportation, they may need to do that before any kind of evacuation orders were sent out approximately 2 days prior.
Yeah, that's that's a lot of movement in for 48 hours, especially when you're looking at a list of about 39 patients there that are being identified as would need assistance in order to do that evacuation. Well, that's not a and the evacuation is north, correct? Towards Jackson and then Florida and Louisiana. If you were looking at a direct hit like we saw in Katrina 20 years ago, coming up on 20 years now.
Yeah, the evacuation routes do go generally northward. There may be a little bit of east-west as you're traveling northward, but the recommendation is not to evacuate east or west because the storm could change track and you may be evacuating into an area that is now suddenly under the gun. And so northward is the recommended direction of evacuation.
With regards to returning post-storm, are there any requirements with regards to placards or travel documents to getting back in after I'm talking primarily about nurses, physicians, nurses, social workers, chaplains, physical therapists, people who are trying to find their patients again, get reconnected with their patients as quickly as possible.
Yeah, for this season, we are participating in the Mississippi Emergency Access Program, MEAP, and you can get more information on that online. It's a statewide system that allows reentry passes. If for whatever reason MEAP is not an option, technical difficulties, whatever, medical credentials will be our backup source of credentialing.
Okay. Those are my questions. I guess I would like to open it up to some of the providers who are on today's call to field their questions as well as in terms of any issues keeping you up at night with regards to this hurricane season and your patient care. Anyone, you're going to have to either use the chat box to type in your question if you don't have a microphone, or you can unmute yourself. I don't see any questions coming in, so I'm hopeful that people are feeling fairly confident about going into this hurricane season with a plan. Uh, Mr. Stratton, any final? Do you have anyone else in your office or in District 9 that wants to give any additional information?
No, it's just me for today, but
Okay.
I do want to encourage everyone to take this time uh, before any storms are brewing out there to put some discussion together with the care group, with the family, with whoever, and make sure everybody has an individualized game plan. If you need any resources from Harrison County, please reach out to myself or Mr. Charles Wise, our ESF8 lead, and we'll assist in any way that we can.
Okay, that's a great point. I just want to remind all of the providers on today's call that every clinical visit, every home visit that you make, whether it's the social worker, the chaplain, the nurse, the physical therapist, is an opportunity for your clinicians to update or make sure the patients are thinking about updating their plan because things change. We know that things change, and we need our patients to constantly and families to constantly be thinking about their plans for this hurricane season. And if at all, if there's any opportunity to get family members involved in helping these folks evacuate, or neighbors, or church communities, or civic groups, if anybody can help take responsibility for evacuating your patients other than relying upon Harrison County, I know the county is going to be much more very grateful, but also your patients will be, because they'll have a lot more say in terms of where they're going and when they're coming back. So I want to wish if there are no other questions today, Mr. Stratton, thank you for your service and also for getting on today's call and being part of this discussion.
Okay, thank you. Have a good day.
Thank, thank you. You too. Are there any other questions from anybody else with regards to emergency preparedness anywhere in Mississippi or in Louisiana that we need to get information on or clarification? Okay, well, not hearing any other questions, I want to thank you all for your attention today and remind you that next week, I hope you have a good fourth in between that, but next week we'll be looking at region number 2 in Louisiana. Thanks, everyone. Have a great fourth, safe fourth, and we'll see you next week.